Hello, I'm Dr. Sherry Williams, and I'm a critical care and lung specialist at the Metro Health System. In my role as a pulmonologist or lung specialist, I take care of patients who have lung disease, such as lung cancer and COPD. As a critical care specialist, I take care of patients in the intensive care unit. Today, I'd like to talk with you about the continued impact of tobacco, secondhand smoke, and its impact on health. I'll also be talking to you about tobacco cessation resources and services available in the state of Ohio and Cuyahoga County. Cigarette smoking remains the leading cause of preventable death and disability in the United States. Even though there's been a decline in the number of people who smoke, over 16 million Americans have at least one disease caused by smoking. This amounts to $170 billion in direct medical costs that could be saved every year if we could prevent youth from starting to smoke and help every person who smokes to quit. According to 2019 Cuyahoga County Community Health Needs Assessment, 15% of adults in Cuyahoga County were current smokers. The assessment also highlighted that 24% of adults identified as former smokers and 62% reported to have never smoked. The top forms of tobacco that Cuyahoga County adults reported using included cigarettes, 17.1%, e-cigarettes, other vaping products, 7.2%, and cigars, 6.3%. As this chart demonstrates, tobacco is used by all populations and demographics. However, we know that smoking disproportionately affects those that are most in need, such as the poor, the homeless, racial minorities, LGBTQ persons, and those suffering from mental illness and substance use disorder. Tobacco companies often target their advertising campaigns towards low-income neighborhoods and communities. As lower-income cigarette smokers suffer more from diseases caused by smoking than do smokers with higher incomes, these individuals have higher lung cancer risk than others and have less access to health care, making it more likely that they are diagnosed at later stages of diseases and conditions. In adults, exposure to secondhand smoke has been found to increase an individual's risk of experiencing a stroke. In fact, according to the CDC, when an individual is exposed to secondhand smoke, it can increase their risk for stroke by 20 to 30%. The thousands of chemicals and toxins found in secondhand smoke can cause nasal irritation and respiratory complications and conditions such as asthma. In addition, research has shown that individuals that are regularly exposed to secondhand smoke can also have increased vulnerability to lung cancer and coronary heart disease. Secondhand smoke can also weaken the immune system and make an individual at a greater risk of experiencing illness or an infection. The home environment is commonly where children are exposed to secondhand smoke. Secondhand smoke exposure can significantly impact the respiratory health of children. Children exposed to secondhand smoke have higher rates of asthma and are at a higher risk of being diagnosed with lower respiratory infections such as bronchitis and pneumonia. Furthermore, children that live with a family member that smokes experience more ear infections compared to children that do not live with a smoker. As we continue to learn more about the coronavirus or COVID-19, every day new research has demonstrated that tobacco use can increase an individual's risk of experiencing severe COVID-19 symptoms. A recent study published in a scientific journal titled Tobacco and Induced Disease highlighted that there is likely an association between smoking and negative progression and adverse health outcomes. Now is the best time to quit smoking and begin your journey to a tobacco-free lifestyle. By becoming tobacco-free, you are able to protect your health and the health of your friends, family members, and peers. It is never too late to quit. Set your quit date to be on November 19th, 2020, which is the annual Great American Smokeout. For 40 years, the Great American Smokeout has provided the opportunity for individuals that smoke to kick off their commitment to a healthy, smoke-free life. There are resources available to Cuyahoga County residents that are looking to quit tobacco. The Metro Health System provides an array of comprehensive tobacco cessation services at our main campus and satellite campuses. Recently, we added virtual classes as well. Individuals can call 216-778-7503 or email mhquitsmoking@metrohealth.org. The second resource is the Ohio Tobacco Quit Line. The Quit Line is available free of charge to all adults in Ohio, regardless of insurance status or income. The Quit Line provides telephone counseling, a text messaging program, and a web-based facilitated chat. Enrolled participants can receive up to 8 weeks of nicotine replacement therapy if desired. The program provides a specific protocol for pregnant women and for individuals that are experiencing behavioral health symptoms. Individuals that are interested in quitting can call 1-800-QUIT-NOW to get connected to a professionally trained quit coach. The Quit Line is available 24/7 and is confidential. Lastly, as we have seen a rapid increase of the number of adolescents and teenagers utilizing electronic vapor products and developing a tobacco dependence, My Life, My Quit was launched in 2019 to support teens that want to quit tobacco. Through My Life, My Quit, teens can call or text 1-855-891-9989 to gain free and confidential telephone, texting, and online support from a trained coach.